So my name's Sarah Golding and I'm here today on behalf of the Public Health England Behavioural Insights team. I'm going to be giving you a very quick overview of a trial that we ran in 2014-15 in relation to the National Childhood Measurement Programme. But first of all, what are behavioural insights? So some of you might already be familiar with this concept, with this approach, but in essence, what behavioural insights means is we take evidence and theory from psychology, from health psychology, social psychology, cognitive psychology, behavioural economics, and a range of other sort of social science disciplines. We bring together that knowledge and evidence from studies, and then we apply them to areas of policy. So today, childhood obesity. And what we do is in terms of applying it, what we're really interested in is how can this knowledge be used to improve or enhance existing processes. So it's not, the behavioural insights approach is not about designing big complex interventions. It's about looking at existing systems and looking to see where we can make small tweaks that are relatively low cost and easy to implement in order to try and improve public health outcomes. And one of the key parts is that we like to draw on the science to inform the intervention, but we also like to use a scientific approach. So wherever we can, we'll use a randomised controlled trial design. But if that's not possible for some reason, we will look for an alternative, robust way of evaluating our interventions. Because of course, one, we want to know that it's effective, that it has our changes have had an impact in a positive way. But we also want to make sure the interventions are acceptable, that they are cost effective, but also that we're not doing any harm. So we want to make sure that, for example, we're not widening health inequalities with our interventions. So we always try and evaluate one way or another to see what the outcomes are and the impacts on the populations that we're working with. So as I said, we draw on science and theory and evidence. This is just one model. There's lots. I'm going to very briefly talk about two models that we draw on, or two frameworks that we draw on quite a lot. We do use others depending on the research question. This is the Combi model of behaviour, which some of you might be familiar with. And it's the idea that in order for a person to perform a behaviour, they need to have the capability, the opportunity and the motivation before they will be able to act in a particular way. Now, traditional public health interventions often draw on the top three sections. So psychological capability relates to things like knowledge, physical capability is things like skills, and reflective motivation would be thinking it through. So much like Sarah was talking earlier, where we're telling people a particular message and asking for them to reflect on how harmful a given behaviour might be. Those things, there's a place for them and they are needed, knowledge and skills are needed. But what behavioural insights approaches do tend to draw not exclusively but almost exclusively on the bottom three. So we look at the more automatic reflection. This is things like how our emotions influence our behaviour, all of the unconscious everyday decision making, the unconscious biases that we just don't pay attention to. We're unaware that they are influencing our behaviour. And the social and physical opportunity refers to things like our social environment, so the social norms, what we see other people doing around us, the beliefs of other people, how they impact on us. So changing the social environment and also the physical environment as well. So are there barriers or facilitators in the environment, and can they be changed in some way just to make it easier for people to perform the behaviour that they probably want to do but can't because of all the kind of competing other things that are stopping them being able to do the behaviour. Another framework that we use is EAST. This was developed by the Cabinet Office Behavioural Insights team, and this is not as comprehensive as the Combi model, but what it does is it summarises lots of different insights from different areas of psychology and behavioural economics into these four categories. So if you want a behaviour to happen, you need to make it easy and attractive. Definitely highlight any social elements of the behaviour, make a behaviour social or more social if it isn't already. And interventions to encourage change should be delivered in a timely manner. So that's that in a nutshell, and I won't go into it in more detail, but there's lots of different concepts that underlie each of those four areas. And I'll talk about a couple in particular relation to the trial in a moment. So developing the feedback letter, we started out with a literature review to kind of look at what is the existing parental acceptance, for example, around the National Childhood Measurement Programme, and what things from the psychological literature might actually help parents to engage more with the feedback letters. So we ran a cluster randomised controlled trial. This took place in 3 counties. It was Leicester City, Leicestershire and Rutland. There were just over 280 schools, and they were randomised to either a control arm or an intervention arm. And the primary outcome measure was uptake of weight management services for the children, and it was in Year 6 children. So I'll run through exactly what was in control and intervention in more detail. As I said, it took place in these 3 counties, and Leicester in particular is obviously very ethnically diverse. So the control group, they received the standard feedback letter that was based on the national template for the 2014-15 years. Parents for all children, regardless of their actual weight, their BMI in Year 6, received Change for Life tip sheets and also local activities, so suggestions for activities they can do in their local area to get their children and themselves more physically active. Parents whose children were either overweight or very overweight received the Flick Flyer, which was the Family Lifestyle Club, which was the weight management service that was in this area. The terminology, so in the letter, children were referred to as very overweight rather than obese, but it was the BMI cutoffs that were used. This is just an example of the Change for Life thing and a summary of the letter. You don't need to read the detail, that's fine. That's just the existing letter that was the template. In the intervention group, we did 3 key things. So we changed the wording of the feedback letter, and again, that was drawn on behavioural insights to inform how we changed the wording. Again, all parents got the local activity sheet and the Change for Life sheet, and the parents of the overweight and very overweight children got the same Flick Flyer for the weight management services. We also added something called the MapMe images, which are similar to the things you have on your table, and I'll show you an example in a moment. They were for children specifically, whereas yours are for adults. And there was also a pre-populated booking form included with the letter with the child's name, designed to make it a bit easier for parents to make that first contact with weight management services. So I'll run through these in more detail and show you how they were kind of based on the theory. So the first thing was the MapMe images. We specifically put a call to action in the letter to try and prompt people to actually engage with the images. And this is an example of it. So this was the one for girls. There was also one for boys. Now, the reason that this was included, the reason we thought this might be a helpful thing for parents is that, as Sarah said earlier, there's quite a lot of good evidence that parents don't recognise their children as being overweight or obese. And actually, there is some evidence that suggests parents don't really relate to the notion of BMI or other objective measures such as growth charts. What parents tend to do is visually compare their children to other children. So in an ever-increasing, where obesity is becoming ever increasingly more common and more normalised, it becomes harder for parents to recognise that their children might be overweight. So this is why we included this. We thought it might be helpful for parents to kind of increase their recognition of their children's overweight or very overweight status. The second part of the intervention, this was in the same letter, included a social norm statement. So social norms can be very powerful. We tend to do what we think other people are doing. And if we realise that our behaviour is out of step with other people's behaviour, again, we're more likely to adjust our behaviour if we realise that we're in a minority. As Sarah said, the media is normalising obesity, which makes it difficult for us to think, well, everyone is obese, we don't need to do anything about it. So we used a social norm statement that essentially said, your child is in a minority of children in your area who is overweight or very overweight. And then we also used kind of a reverse of that statement that says 2 out of 3 children in your child's year are a healthier weight than your child. And those messages were personalised. It had the child's name and the specific local area as well. And that was to try and encourage parents to realise that their child's obesity wasn't normal. And then finally, the third part was the pre-populated booking form, and that was pre-populated with the child's name and the school, and this is designed to try and reduce a barrier. So it might sound very simple, but having to go and look at something in order to pick up the phone, or every extra box you have to complete manually, it's all an additional friction to actually making that first contact. So by pre-populating some of that information, we were trying to reduce those friction costs, and also there was a free post envelope included as well, so that there isn't the simple barrier of finding a stamp, affording a stamp, things like that. this is the pre-populated booking form, and it also had an opportunity for parents to provide details of when they would prefer to receive contact to make it a bit easier again for them. So just very quickly bringing this back to the EAST framework that I mentioned at the beginning. So we're drawing here on things like the descriptive or social norms that exist, and also relative ranking. So helping when you understand your performance in relation to other people's performance, there's quite good evidence that that can motivate people to do something differently. Feedback is happening already in the letter, but we were trying to enhance the way that that feedback is received. And easy, I've already mentioned the reduction of friction costs. So anything you can do to remove a barrier makes it more likely that that behaviour is going to happen. So what did we find? Well, within this area, the cohort that we looked at in 2014-15, around 3,300 children were overweight. Were overweight or very overweight. So 1,400 overweight and just under 2,000 very overweight. So amongst these overweight and very overweight children, their parents would have received the pre-populated booking form with the details for the weight management service. We also checked to make sure that both groups were balanced on things like ethnicity, gender, measures of deprivation and so on, and they were. So we were satisfied that our randomisation worked. As you can see, overall, it was just under 70% of the sample were white, around 22 in both, 21 in the control, and 19% were Asian, and around 10% were either black or mixed or other. And what we found was that our intervention, our letter and the additional materials did actually increase the uptake of weight management services across Leicestershire, Leicester City and Rutland. The numbers are very small. Getting parents to engage with child weight management services is notoriously difficult, and actually referrals and uptake is very small, but we did see a doubling in parents who made the first contact, parents who actually enrolled their children, and then the attendance for the first appointment. And so to conclude, the intervention did increase weight management services. So the trial demonstrated that you can increase uptake by making sort of low cost, easy to implement changes to an existing letter. What we can't say for certain is exactly which aspects of the intervention worked, because it wasn't a factorial design. People either received the control letter or the intervention letter. If we'd had a much, much bigger sample, we would have trialled different versions of the intervention letter with different segments to see which bit was having the biggest impact. So we don't actually know whether it was the social norms, making it easier, or the actual visual images that were having the most effect on parents' behaviour. And so the recommendation really would be at the moment to repeat, if this was something that people wanted to consider rolling out, would be to replicate the letter and the materials in their entirety, but of course paying close attention to the effect it's happening in the local area. And that's that. Thank you.